Welcome to the third day of WCCICC TV presented by Emcure Pharmaceuticals, and you are watching me on TheRightDoctors.com. I am honored to have with me today Professor Sobhan Vinjamuri sir. Sir is the President for British Nuclear Medicine Society, and sir is working for the Department of Nuclear Medicine, Royal Liverpool University Hospital, Liverpool. So I am honored to have you with you, sir, on this show.
Thank you.
Thank you. Sir has given a beautiful talk on the quality assurance for nuclear medicine procedure in cardiology. So I would like to know from you, sir, the concept of the peer review in relation to this.
Yes, I think when we are providing a service to patients, we need to be able to provide services to a very high standard. And how do you show that you are providing services to a high standard? You can have a lot of satisfaction on your own, but it is actually enhanced a lot more if you invite some peers to come and look at your service, comprehensive review, and they will be able to then back you up to say you are providing a very good service. So in my concept, it's very important to have peer review built into routine practice.
Okay. And how frequently you like to do such kind of a peer review?
It depends. It could be between 3 to 5 years, once every 3 to 5 years. I think it will be good. And it will also give confidence to the clinical team referring patients to you. And it also gives confidence to the referring doctors and to the management of the hospital, because they want to know that the people whom they have invested in is actually of a very high standard.
Right, sir. So, sir, according to you, to make this happen actually in the world, what are the key things that are required so that we can make sure that yes, the peer review will happen?
So essentially what we need is some body like the World Congress to take ownership of this, because you cannot do this on your own within the hospital. It has to be external, and it has got to be with a body that has got reasonable clout across the globe, who can then combine the expertise from different geographical areas, because what is excellent for one part of the world might not be good for another part of the world. So we need to be able to get that concept. So I think some group needs to take ownership of this and then promote this, and then it will become a badge of excellence for people to take on board. I think peer review will be good. Right, that concept.
Right, sir. So, sir, to make this happen for the quality assurance of nuclear medicine, what key message you would like to give?
So, I would like to say that people should not be afraid of inviting other people to come and look at their service, because a lot of people are very defensive.
Correct, sir.
They feel that if somebody comes and identifies faults, they might be putting me down.
Yes.
I think people should not be afraid. So, the key message is do not be afraid. You provide a good service as per your specification, as per your understanding of the guidelines, and the peer review will provide help for you to improve it. You should see it in that constructive role rather than a negative perception of peer review.
Right, right. So, sir, it is said that there is always area for improvement. So, do you feel that the people should be open for such kind of a concept?
Absolutely. I think people should be open for improvement. Nobody is perfect.
Correct, sir.
Everybody should have this perception that I can do better, and you should be able to take help from colleagues. So I think it is, people are very guarded. They do not want to do this, but I think it will be good for them.
Right. So do you think, sir, the peer review will take this to the next level?
I personally think it is going to be the next level, and the level after that, which is that your referring cardiologist may not refer patients to you if you do not have a badge of approval from some group. So that is going to be a key factor for deciding. So if you have a badge of approval from a peer review, it will be good for you. You can then promote your service to others. So I think it will be a fantastic tool in that context.
Okay. So thank you so much, sir, for such a wonderful discussion and having with me on this show. Thank you so much.